Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top news. Negligence in intracranial stenting, hospital fined ₹16 lakh. The District Consumer Dispute Redressal Commission in Kanchipuram has ordered a private hospital and its consultant doctor to pay ₹16.36 lakh as compensation for medical negligence. The case involved a patient who suffered a paralytic stroke following a right middle cerebral artery intracranial stenting procedure. The consultant doctor Graduhari lacked the requisite qualification to perform the surgery. The hospital was held accountable for engaging the doctor without verifying his credentials. The court noted discrepancies in consent forms and medical records. Despite the hospital's defense citing prior counseling session and inherent procedural risk, the commission found deficiencies in pre-procedure documentation and held the hospital liable for unfair trade practices. Therefore, holding the hospital and doctor guilty of medical negligence, the commission directed them to pay ₹16,36,176 towards compensation for mental agony, deficiency in service and unfair trade practice, including a sum of ₹6,36,176 spent by the complainant towards the treatment charges. Apart from this, they were directed to pay ₹25,000 as cost of the proceeding to the complainants. NEET 2024 hearing in Supreme Court rescheduled to July 18. Supreme Court has deferred the hearing on pleas for reconducting the NEET UG 2024 exam to July 18 as some parties had not received the latest affidavits from the central government and the National Testing Agency. Chief Justice of India noted that advocates for the petitioners need some time to review the affidavits. The postponement was also influenced by the unavailability of Solicitor General Tushar Mehta on July 15 and 16. The CBI, currently investigating allegations of malpractices and a paper leak in the NEET UG 2024 exam, has submitted a status report which will be reviewed in the next hearing. The court acknowledged that cancelling the entire exam could adversely affect 24 lakh students. The bench, led by the CJI, has asked the NTA and the union government to identify whether the paper leak was systemic and to pinpoint any beneficiaries. The court hinted at a possible limited retest for those who benefited from the leak and sought updates on the actions taken to identify these individuals. Additionally, the court recommended forming a multidisciplinary committee to prevent future leaks, and if such a committee already exists, it requested details on its measures. The central government, in its Wednesday affidavit, opposed reconducting the exam, arguing that there was no evidence of mass malpractice or a localized group of candidates benefiting, leading to abnormal scores. WHO Prequalifies for self-test for Hepatitis C virus. The World Health Organization has pre-qualified the first self-test for Hepatitis C virus, the Aura Quick HCV self-test by Show Technologies. This advancement aimed to expand access to the HCV testing and diagnosis, accelerating global efforts to eliminate hepatitis C. The self-test is an extension of the Aura Quick HCV rapid antibody test pre-qualified professional use in 2017 and is designed for lay users. The WHO recommended HCV self-testing in 2021 to complement existing services based on evidence of its effectiveness in increasing access and uptake, particularly among those less likely to test otherwise. National implementation projects have shown high acceptance and feasibility of HCV self-testing, empowering individuals through personal choice and stigma-free self-care. Dr. Meg Doherty, WHO Director from the Department of Global HIV, Hepatitis and STI programs, emphasized the critical need for expanding HCV testing and treatment, noting that only 36% of the 50 million people living with hepatitis C had been diagnosed, and 20% received curative treatment by the end of 2022. WHO's pre-qualification program assesses in vitro diagnostics for quality, safety, and performance, supporting countries in achieving high-quality diagnosis and treatment monitoring. Dr. Rogerio Gaspar highlighted that this pre-qualification enables low and middle-income countries to access safe, affordable self-testing options essential for diagnosing 90% of all people with HCV. Cholera outbreak, Rajkot and Jamnagar regions affected. Several areas in Rajkot and Jamnagar have been declared cholera affected following the confirmation of positive cases on Thursday. In Rajkot, a 6-year-old boy from the Lohanagar railway crossing on Gondal Road was diagnosed with cholera. Additionally, 6 other individuals experiencing diarrhea and vomiting are currently undergoing treatment. The Rajkot Municipal Corporation identified contaminated water in a house water tank as the potential source of infection. RMC staff conducted a comprehensive survey of 448 houses in the vicinity, examining over 1,700 residents. All patients are receiving treatment at home. The RMC health team has also provided guidance on maintaining hygiene and distributed chlorine tablets to prevent further infections. In Rajkot Rural, health teams have screened over 72,000 people following 5 suspected cholera deaths in Upleta last month. In Jamnagar, the district collector declared 4 areas: Bedi Bandur Health Center, Gandhiwad Health Center, Khojawad Health Center and Bombay Healthcare Center as cholera affected. A notification under the Epidemic Disease Act was also issued to address the outbreak. The authorities are taking rigorous measures to control the spread of cholera and ensure the safety and health of residents. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.